the purpose of this video is to demonstrate how what exercise we choose or how we do it is going to impact our ability to either make a positive change or potentially can actually lead to a negative change. And we're going to use Zach as our test dummy, and we're going to do this live so that you can see this in real time. I think it's really easy to, not necessarily fake, but easy to show whatever we want in a still frame picture. So you're going to see in real time, we're going to use one range of motion test as the example. We're not going to go through our whole assessment just because it's not needed for the context of this video. So we're going to use shoulder internal rotation as the test. This test alone is not enough for us to know what to do. We already have some information on Zach anyway, so we're doing this purely as a demonstration so you can see how one thing could make the internal rotation improve, and then something else that is going to be like a fairly traditional just weight room activity has the ability to steal it. And then what we want to really understand is how is this going to help inform us on how to program for people that maybe are dealing with pain, or even how to program for people that are just trying to drive like fitness related goals, but want to do it in a way where they're minimizing some, let's say, negative consequences of what training can provide. So we're just going to take a look at shoulder internal rotation on both shoulders just as a demonstration. I do my best to be as consistent with how I'm measuring as possible. So to give you an idea, if a forearm facing straight up to the ceiling is 0 degrees, everything beyond that would be a positive number. So what do we want to call that? Somewhere between like 10 and 20 degrees on his right side. If we look at his left side, pretty comparable, right? 10 to 20. So I'm not going to do anything hands-on. I'm just going to have Zach stand up and do the first exercise that we kind of decided that he's going to work on. So he's just going to do a really simple like wall-supported squat. It doesn't mean that this is magically a solution for everybody. It also doesn't automatically mean that it's the perfect exercise for him. But again, we're just going to use this. He's going to go for 2 or 3 sets. And we're just going to allow him to go through these exercises so we can get enough volume or influence to actually elicit a change. So as we're going through this, Zach obviously knows how to do this, so I don't need to coach it. What we want to be able to understand is when we're working with different patients, and if we are confident that we're making a positive change, we can't just use that as a way to basically say, okay, great, now we just need to get stronger, or now we're able to progress. We need to constantly almost recheck our work to see what type of influence is what we're prescribing for them having. Is it creating the change that we're expecting to create? Are we maintaining those changes? Or is something in our routine potentially interfering with what our ultimate goal is? If we don't recheck our work and we gave somebody, say, 5, 6 different exercises, even if those exercises in a vacuum are great exercises, if then they are either not seeing the changes that you want or not maintaining them, you're not sure which activity was the culprit or how they were executing one of those activities. You don't know like where in the process did things break down. So again, we're just using one exercise in this example, hoping to see a positive change on the table. And then we're basically going to choose something that I'm hoping is going to be kind of past that threshold of kind of executing with some form of compensatory form that's going to lead to the same exact motion dropping off. And then how are we going to use this information to decide what's the best collection of exercise to give someone like Zach if the intention is to maintain that change in the first place. So we'll let Zach finish the 2 or 3 sets here. We'll go back in the room, recheck. Hopefully we see some changes that we want. If not, we can kind of decide what to do from there.
All right. Hopefully that's enough.
All right, let's check. So again, I'm going to do my best to be as reliable as possible with the retest because we don't want to just see what we want to see. We don't want to measure in a different way that's going to basically fake an increase in motion. Obviously, our intention is not to do that and then see a reduction in motion. So our hopes is that we're going to see something above the 10 to 20 range that we initially started with. So if we want to call that about 40, right? A little bit of a change, nothing crazy. but still more than where we started. We'll check the left side. Same thing, probably about 40. What I would do first, and this is partly because I already have some information on Zach, I would probably have him go back and do another 1 or 2 sets of that, because I think we have a little bit more that we can get out of that one exercise to begin with. So if you want to just go back, do another set or 2, just so we can get like a little bit of a bigger discrepancy in the baseline. Admittedly, for a visual like this, getting from 10 degrees to 30 degrees isn't like a dramatic change to really have it be meaningful at all. Now, if this was actually like a patient in the clinic, right, the types of change or the amount of change that you get from a single exercise obviously informs your decision making. Could I have stayed on the table and maybe jumped right to something manual because we knew that it created some type of influence, but now we want to say like we want a greater influence? Absolutely. Could it have meant do more of the same exercise? Could it have meant choose another exercise that helps reinforce what was creating some change? There's a lot of different directions that we can go from here. We're trying to do one thing so that we can just use this as a demonstration. We'll hit one more set. Let's stop there for the purpose of being able to demonstrate. So
No one wants to listen to me just breathe.
hop back on the table. Okay, we'll come back to the shoulder. Okay, so that's a little bit of a better visual where you could tell 45 degrees is a pretty good marker of like easy to see with your eyes, like definitely getting past 45 degrees. And all we did was repeat the same exact exercise, just got a little bit more volume. So if we started at, what, 10 to 15, and then we got to maybe about 40 degrees, and now we're getting to maybe about 50 degrees, like you're seeing the direction that we're moving in. Maybe a little bit better with my hold. Same thing, probably just past 45 degrees. So I'm happy with that just to demonstrate something changed in response to, one specific exercise that we chose for Zach. Now what I want to demonstrate, we're going to use something like a push-up. I'm just going to have Zach basically do like around a set of 10. I'll let him decide when he wants to stop. What we already know for Zach is he has a tendency of having like a little bit of like elbow discomfort if he does too many push-ups, right? So we have that information already. But he's going to go do a full set, and then we're going to come right back on the table and recheck the same exact motion. Now, if this was an exercise that I actually want him to do as part of either his training or his rehab specific to what he's coming to see me for, then my hope would be as he's progressing through this, it's going to help maintain the changes that we made. Now, a little bit of drop off, not the end of the world. There's normal trade-offs with any type of strenuous activity, right? It's not only about range of motion, but if he were to do this, get back on the table, and it looked like we never made any positive change in the first place, it tells us something about either the exercise that I chose or how he executed it is going to negatively impact the change that we're attempting to create on the table. So let's go back in. And again, we're doing this live. There's no editing, not that I would have the skills to edit this anyway. So I'm intentionally pushing hard too, just to demonstrate this. So I'm pushing really hard on the shoulder, but right, we'll call that less than 10 again. So it's as if we never did that first exercise in the first place. Let's come back to the left side. Same thing, limited on both sides. So basically, what we want to understand is how is that last exercise potentially going to negatively impact our ability to maintain the changes that we're looking for? It's not as simple as just saying, training versus rehab. There's a lot of nuance that comes into why we're choosing the exercise that we're trying to choose and how we're going to determine if it's an appropriate exercise for the individual. A push-up is a great exercise. This is not implying that push-ups are going to hurt somebody's shoulder. It's saying for Zach, specific to if our intention was to try to maintain the most amount of motion in his shoulder as possible, a push-up at this point in time, that specific variation would not be what I have in his program. Now, could a different variation or a modification or a change in doing certain things prior to getting there open the window or give him an opportunity to do that same drill? Possibly. That's where some of the skill side of programming comes into it. But if we don't know to look at these things and we don't understand the fact that it's not as simple as just calling that like an upper body exercise or a lower body exercise. There's more nuance to how one thing is going to impact how our body is able to move. Then we're going to miss the boat on some of these things that are kind of underlying that could impact our patient's ability to create change or maintain change. So hopefully this demo was good. We're going to be able to make some other comparable videos to this where we're going to demonstrate some common exercises in the gym and show you how it could either positively or negatively impact how somebody moves. But understand there's nuance to this. This is not trying to demonize any particular exercise. Obviously, Zach is the only model that we're using for this particular activity. So don't take this information and run and pretend like we're trying to call this a bad exercise. It's just understanding a little bit deeper as to how we choose the right activity for the right person.